Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com. Let's talk about no spells required, how to prevent witchy aging and concave profiles, future-proofing your orthodontic case. And too often I do a case with somebody, and it might be a teenager or something, or even someone, a young adult, and it's a really concave profile with very strong facial features. Hey, I get that. We have lots of strong facial features in our family. We have what we call the Wilson chin, which, hey, you can see my chin. Whee! We naturally have pretty concave profiles. Luckily, actually, we have pretty good lips, so it balances out a little bit more. But as you age, your lips thin out, right? So it's an optical illusion. It looks like you're becoming more concave, but you kind of are. You are becoming more concave. But in essence, it's not that your nose and chin are growing, it's that everything else is shrinking, making them more pronounced, and then gravity is causing things to droop. So if you finish a case and it looks concave, it's going to look significantly worse in 10, 20, 30, 40 years. As the patient ages, they're going to look so much worse. Of course, they can get genioplasty, have their chin shaved, they can get rhino, have their nose redone, tip lifted, stuff like that. But the goal is when we're doing orthodontics to try to balance out the existing profile as much as possible. We shouldn't assume our patient's going to get cosmetic surgery. And sometimes we can't. Sometimes we move the teeth as far forward as, God allowed it to be. Like maybe that's just their teeth. We can't move them any more forward, right? But sometimes people are making these rash decisions, trying to push things back, trying to extract teeth. And I'm like, whoa, 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 you're going to make them look terrible. I mean, remember the E-line philosophy. And if you don't know what an E-line is, go to all my content I have on E-lines and profiles and everything and look at that, because we want to try to balance the E-line. Full profiles are much more popular. Don't go by the Ceph numbers. My goodness, if you're treating to a Ceph, you're making a mistake. Those are some old numbers based on Caucasian people, not even data from the 40s. I mean, that's insane if you're treating to the Ceph directly. I mean, the Ceph should be a guide, like, oh, okay, Ceph says this face is long. Yeah, that's useful, but don't have the Ceph tell you what to do, if that makes sense. So that's pretty much it. Just be cognizant that the profile will get worse. And we're not going to tell a patient that. We're going to say, you have some very nice, strong profile features. These are very popular. Look at Reese Witherspoon is a great example. Somebody with strong features, a little bit of a concave profile. We want to balance out a concave profile with a nice full lips, full profile to keep it balanced and harmonious. So we just want to match the features, what the orthodontic finish with the current features of the patient so that it grows with the patient. That is the main thing. So remember, lips will always thin out, cheeks are going to thin out, but noses and chins will not thin out. They will become more pronounced due to gravity. And the fact that they are made of cartilage and bone, and that doesn't atrophy, whereas soft tissue like lips and cheeks and fat pads atrophy. All right, thanks so much.